Welcome to Early Intervention Matters, the podcast that helps parents, teachers, and health professionals understand the diagnosis, treatment, care, and support of children with autism, ADHD, Tourette's, and other neurodevelopmental challenges. Your host, Dr. Inyang Takon, is a consultant neurodevelopment pediatrician, and she will provide insight through interviews, answering questions, and breaking down complicated topics. By sharing stories from parents and professionals in the field, we hope to make sense of what can be an overwhelming topic. Early intervention is crucial with children with developmental difficulties. Yes, early intervention matters. And now, here's your host, Dr. Inyang Takon.
Hello everyone, you're all welcome to today's series of our Early Intervention podcast, and I'm Dr. Inyang Takon, and today we're going to be talking about early signs of autism spectrum disorder, and I'm going to be talking about how children present and what to think about when you see any of these signs and what to do if you're concerned. So autism spectrum disorder is one of the commonest neurodevelopmental conditions that we see in children. When we talk about neurodevelopmental, it's referring to conditions that occur centrally located in the brain, but occur when the child is developing. So in the early years of development, these conditions begin to set in, and you begin to see the signs as the child grows. Now, an autism spectrum disorder involves difficulties with the child's ability to communicate, so make their feelings known to others. They have difficulties with expressing themselves, and they have difficulties with social interaction. And sometimes they can have very particular interest. They can be rigid. When we talk about rigidity, it means they struggle to tolerate things that are not the way they like them. So they struggle to handle change, and they might have other interests that they do all the time, which we call repetitive behaviors. So autism spectrum disorder is becoming more common. Now, we don't have the exact cause of autism spectrum disorder. We don't know what the exact cause is, and there's a lot of research going on. But we do know that there are conditions that appear because of the way the brain functions in children with autism spectrum disorder. So I'm going to be talking to you about the early signs. These difficulties tend to be present when the child is young, although most times children with autism are not identified until they're about 2 or 3. And we expect the ones that are very obvious to be quite obvious to people by the time they're age 2 or 3. And that's why most times diagnosis is usually made around 3, although we're beginning to diagnose children at younger ages. So what are those early signs that we should be looking out for? Now, in the first year of life, you might notice that the baby is very demanding of the parent's presence. You might notice a baby that finds it difficult to settle when the parent is not around, or when the mother, gives the child to somebody else. You might notice the baby is very demanding, cries a lot, and can be quite irritable at that very early stage. Now, it might not be obvious at that time, but you might actually notice that as the child is growing, the child is not really maintaining eye contact with the parent. So sometimes mothers have mentioned that even when feeding the baby or trying to engage the baby looks elsewhere and not looking at the mother's face. Now, we all know, as when we have newborns, we're trying to look into their eyes, get them to look at you, to smile at you, and they smile back. And that to and fro behavior is not present in babies or younger children with autism spectrum disorder. You might notice that the baby becomes very distressed in certain situations. So, for example, if you go to a busy place, you might notice the baby getting very upset then. And these are part of what we call sensory behaviors. So the baby might find it overwhelming if you take the baby into the shop, and you might find that the baby is crying a lot until you come back into the car and you go home, then the baby quietens down. Now, if you notice this pattern happening over and over again, then you should begin to think about what else could be going on, and you should seek help and advice from a professional. One of the other things that can happen is the baby might begin to have sensory things around food. So you might notice the baby doesn't like certain textures of food, especially as they're growing up and being weaned. You might find out that might prefer dry foods. They may not like certain textures or wet foods. They may gag. They may then develop feeding problems. Now, if you begin to see that your child is showing some rigidity around or some sensory difficulties around feeding, and this sometimes can be a big problem for parents, then begin to think, is there any other thing that the child is showing at that time that may be concerning? Some parents report that when they start to introduce the child to attending other group sessions, the child cries and becomes very irritable and doesn't want to be there, doesn't want to be around other children, cries a lot and only wants the parent. And such children might be very difficult to settle in preschool. They might find it difficult to settle, and most times you find some parents have opted to just have the child at home for longer periods. The other thing you might notice is that baby might, as the child is growing up, there might be difficulties around speech. Some children with autism actually have speech delay. There might be delay in expressing themselves, or the whole language development might be delayed. Some children might be, latch onto certain words and say it over and over again. You might find them as they begin their language development, they might be using certain phrases, and you might just notice that child using those phrases over and over again. They might want to copy you a lot, so you might say something and the child says that word repeatedly, and we call that pattern echolalia. So when you notice some of these behaviors and you see that this is something that is happening consistently with the child, then it is important that you seek advice. Some children with autism might become quite excitable over certain things. And when you watch them during those periods, there might be movements they might make when they're excitable. Sometimes they might flap their hands in excitement. And you might see that happening in certain situations. They might become so overexcitable, flap their hands, or move in different ways. Some children, when they're walking, might be tiptoe walking. You might see different physical movements. They might jump continuously on the spot repeatedly when they're stimulated by certain things that, excite them. When it comes to their play skills, some children with autism might prefer certain patterns of play. So what you might find is that there might be several toys you've gotten for the child to play with, but they're not particularly interested in a wide number of toys. They might have specific ones that they like to play with. One of the commonest ones is children who become fixated on certain cars, and they might want to play with certain parts of the car. So they might not just be interested in the whole car. It might just be the wheels of the car. And they might lie on the floor or sit down, rolling that car back and forth. So it's not that they're actually engaging in what you call imaginative play, where they are actually making a scene or making or playing and engaging other people. It's not a play that they want somebody else to come in and join them. It's something that they want to do themselves, and they could stay there and do the same thing over and over again, and they could just be fixated on that. And you sometimes might find that when you try to change that child's play, they become very distressed and they would seek that toy or that game that they want and seek it out continuously. So when you find that your child has what you call fixated interest or repetitive play patterns or difficulty with varying his or her activities, and they want to do the same thing all the time, and you find that they particularly have ways in which they interact with people, so they might find it difficult to go out and meet other people or be where there's so many people, then you should begin to have some concerns about whether the child may be showing some early signs of autism. So in terms of, we've talked about their speech, we've talked about the fact that they could have delayed speech, and we've talked about the fact that they might struggle to express themselves. And just thinking back to those with delayed speech, sometimes we do know that even when a child's speech is not developed and they come over and want to request something from you, they might look at you. You expect that child to look at you in the eye and use what we call gestures. So they could use their hands, they could point to things, and you could understand them even though you don't have the word, they don't have the words for it. What we do find in children with autism is that they do not have the use of what we call non-verbal communication skills. So they're very limited in the way they use gestures. So things like looking into your eyes to direct you to what they want, even using their eyes, or pointing can be very limited. Sometimes they might just come and drag you to take you to what they want. But when they drag you or lead you by the hand, they're not looking at you, which is what we call joint attention. So when we talk about joint attention, you expect the child to look at you and look at what they want and look back at you so that they know that you have actually connected with what they want. Children with autism spectrum disorder struggle with that non-verbal communication. So they may not look at you, they might just drag you by the hand, and it's a case of you guessing what they want. Sometimes they might drag you there and just push your hand towards a certain direction, but they do not look at you to make sure that you've understood them. So not only do they have difficulties with the verbal communication, they also struggle with the non-verbal communication. They have limited use of gestures. They have difficulties with social interaction. So they find it difficult when there's another child there. They find it difficult to go over and indicate to that child what they want to do. They have difficulties with their imaginative skills. So they do not do the wide range of plays or things that you would expect children with typical development to have. They have very rigid interest, very narrow play interest, and they also have sensory behaviors. And like we've talked about, they can have what we call mannerisms, which is, flapping their hands or walking on their tiptoes or doing things that way. So this is what you tend to find in the younger child, which is the early signs that we're talking about. And I would say that in younger children, where you do pick any of these concerns, it's also good to find out whether other people have noticed this. So, for example, the child's nursery or preschool, you could find out whether they have noticed similar patterns of behavior. And if this is being noticed in different sections or reported in different places, then we will recommend that you seek help. It's important that for younger children, you ask your health visitor, you seek an appointment with the GP so that your child can then be referred to specialist services who are going to assess your child further to see whether they have autism spectrum disorder. Now, I would like to add that there's some children that can appear to be functioning quite well until later when their signs may be more obvious. So those children are usually you find they're super intelligent sometimes, and they also have very good language skills. But then if you then go deeper into their presentation, you might find that you may have a child who may have been very good with certain things from a younger age. So you might find a child who is doing maths or reading very advanced levels of maths and English and maybe doing so well, but then there would be what we call deficits in their social interaction. So they might find it difficult to make friends easily. They might find it difficult to follow other people's leads. They might find it difficult to sustain a conversation, and they might find it difficult to adapt to things. So they might be very dominating and domineering in their play. And they could be rigid. So that comes out in different ways. They might be obsessive over certain things. So although the child may have looked really as if they're performing really well when they were younger, and then things might begin to be picked up when they're older. The reason is when the social demands increase for such children, they find it very difficult. And that's when you start seeing the behaviors. So in younger children, you might see it being more obvious, and there's still children that may not have been picked up in the younger years, but things become more obvious as they've grown older. So again, we'd say you find out from the school how that child is interacting with their peers, find out whether there are any particular behaviors that they notice. And then anxiety is something that becomes quite obvious in the older children. So, for example, a child might become extremely anxious if they're going to a new place. They might become distressed. Some children might refuse going to school, and they can become very unhappy at school. So again, when you find a child that is anxious, is about going to different places, and you find out that the child is not keen on meeting people, and they have very narrow interests, you should be looking into whether that child could possibly have autism spectrum disorder. So I hope through this series today, we've been able to pick up some of the what we can call early signs of autism spectrum disorder in different ages, how they can present in children who are verbal and nonverbal. And we've also talked about seeking help, getting more information from the school, and getting help as early as you can. So, as we always say, early intervention leads to better outcome, and early intervention can only be achieved by early diagnosis. So thank you for listening into the series today, this series on early signs of autism spectrum disorder. I know some of the things we've talked about today would probably have generated some questions or need to seek clarification. So I'm happy to take questions, and I'll invite you to send your questions to eim@drtakon.com. Thank you for listening in.